Thank you all for joining us tonight. So walking into residency is like visiting a foreign land of which one knows very little. So with this webinar series, we're going to try and make your transition into residency a little smoother and life a bit easier. You see their fingers dissecting through tissues with strokes of the cautery as if an artist is bringing a canvas to life. Yet a great surgeon knows when not to cut. From crude surgical procedures performed without anesthesia to microvascular anastomosis, reconstructive and robotic surgeries, this field has truly evolved with time. Science and art dance through the realms of surgery, creating a unique discipline in medicine, amalgamating the mind of a scientist with the skills of an artist. Welcome aboard to the SAMSA Meet Our Residents webinar series, edition General Surgery with speaker Dr. Rupesh Pakrasi, hosted by myself, Dr. Meenakshi Khemka. SAMSA is a non-profit, apolitical, non-governmental organization run by young doctors, postgraduate and undergraduate MBBS students with its base in Calcutta, but wings spreading across medical colleges throughout India. On a regular basis, we organize free health camps, workshops, seminars, organ donation drives, and our annual national conference, SAMSACon. Our motto is knowledge with purpose, service with conscience. We can share the web link for SAMSA, please. Our speaker for today, Dr. Rupesh Pakrasi, is the director of SAMSA. He graduated with an MBBS degree from RG Kaur Medical College and Hospital and is currently a second-year general surgery resident at Calcutta National Medical College and Hospital. Dr. Rupesh is going to walk you through life as a surgical resident and share his experiences so it can help determine your path post-MBBS. He is passionate about surgery and takes a keen interest in trauma care and management. I'm currently an intern at Institute of Postgraduate Medical Education and Research and SSKM Hospital at Kolkata. I'm the Secretary of Marketing and Promotions at SAMSA. We do hope we're able to clear your doubts like blood from the surgical field and inspire some brilliant minds to say scalpel please as surgical residents in the near future. So, Dr. Rupesh, we conducted a survey wherein our audience was asked to voice their queries and concerns regarding pursuing general surgery. The Bible of Surgery, Schwartz, talks about how a surgeon is also a leader. So, Dr. Rupesh, please tell us what defines a surgeon's personality.
Hello everyone. First of all, I would just say I would like to welcome everyone to this webinar. And I'm really glad all of you have joined. So first of all, I would like to answer this question by saying that, I respect all, specialties in medical science, but I personally do believe without a doubt that surgeons are basically the sexiest species of doctor. That's something I believe. And when it comes to, the qualities a surgeon must possess, leadership is something which is common to all residents. Be it if you're a general medicine resident, if you're an ophthalmology resident, you have to be a leader at the same time, because once you start managing the wards, you will have certain people under you. You are no longer an intern or a house staff. You have to make decisions by yourself. You have to instruct other people, and your decisions will make a patient better, and so your decisions have become very important as of now once you become a resident. So I would say, when it comes to a surgeon's personality, you have to be very headstrong, you have to be confident, and you have to be a good team member. That is extremely important because, in surgery, even if you're not the lead surgeon on the operating table, you still have a very important role in surgery, and it's based on teamwork completely. And I would also address a misnomer. It's often said that surgeons are very arrogant and they feel very pompous and everything. But I feel that that kind of a thing is not helpful at all. I mean, empathy is something that is common to all specialties in medicine, and it should be an integral component of a surgical resident's, personality, the relationship you develop with your patients, and how you interact with them definitely plays a very important part in their, psychological well-being. And it also makes for a wholesome, experience for them. So yeah, this is about it when it comes to personality.
Yes, Dr. Rupesh, definitely. Compassion and confidence, I believe, defines a surgeon. So rightly put. So, as adults, we learn to prioritize. Our careers often dictate our lifestyle and choices. So, it's important to consider all aspects while picking a certain field. So, tell us, Dr. Rupesh, what is a day in the life of a general surgeon, a resident like, more specifically?
Yeah, so I mean, when it comes to this question, I would like to tell you like how life is. Right now, because of the pandemic, the pressure in the wards is not that much. But let's just take my admission day. Like, if if it's admission day for me, I would like wake up at 7:30. I would have some coffee. I would like drive to the hospital and reach there by 8:30. I would do my morning rounds, see the patients that are already in the wards, and then prepare for the OPD, which is another like 6 hour thing, right? And after in the OPD, you see certain patients and they're admitted, and certain emergency operations are also decided in the OT. So after you finish the OPD, which is around 300 to even 400 patients, and like on an average, when there are 4 5 people seeing patients, you at least see around 70 to 80 patients yourself. So it is pretty hectic when it comes to that. And you make a list, and then what you do is after the OPD gets over, what I have to do is I have to shift towards the emergency duty. Once I go to the emergency, I have to again do a second. I have to do a second round about the wards because of the new patients that have been admitted. And after I see them finally, I take this final decision, which is a very important decision during the evening rounds. That is whether or not to operate on a particular patient. It develops with time. I mean, it won't. They won't. I mean, your seniors won't hand you this responsibility right at the beginning when you join. But the evening rounds during your admission day is extremely important because, like Meenakshi rightly said at the beginning, a good surgeon has to know when not to operate, right? So we utilize this evening round for basically targeting the patients who need emergency surgery and who do not need emergency surgery and can be looked at a later date. So and then we just start after this. The emergency procedures start, with the short cases, the operations that have been planned, and there's a continuous influx of patients throughout the day. And on the admission day, you can barely sleep for, I guess, 1 or 2 hours before, and you have to get up the next morning around 7:30, go for another set of morning rounds, and prepare everything, set the wards all neat and tidy before your professors, come in. And yeah, it is hectic for an admission day. And I think that we have a link for, an ideal admission day, which I think one of our colleagues at RG Core has made. I think it's very informative when it comes to our setting. He has basically described how life is like for a surgical resident in a 24 hours duty or something like that. So if you guys can share that link, that'd be really good. Meenakshi?
Yes, Dr. Rupesh, tell us how much time you get during your first year residency to unwind, and how much time do you have for yourself amidst the busy schedule that might help people make an informed choice when they take up general surgery?
Right. So what I just described is the admission day. That is just one day in a week. The rest of the days, if you're a first year, you definitely have to go early to work. It's like my senior used to tell me that in first year, when you go to the hospital, all the shops will be closed, and when you come back from the hospital, all the shops will be closed. So basically, you're the first one to go into the hospital and the last one to come out. But it's all required. It's all part of your learning curve. And when you talk about like rewinding, for me, I used to get the Sunday evenings off in my first year. And I think that I utilized that time for whatever rewinding, watch a movie, read some books or something like that. And mostly on the weekdays, I was too tired. When I came back, I would like either, study something that I learned over the day. And most of the time I was too tired and just, it's best to go to sleep, because next day you have something else. But yeah, I mean, if you really like what you're doing, it won't seem that hectic and you will really enjoy it. I mean, because this is something you love and you will enjoy it. And I would say, work hard, play hard. It doesn't matter if it's, if you have a 12-hour duty or something. You can always find time for doing something you love or, some recreation by yourself. So yeah, if you love the subject, it won't matter, to be honest.
Definitely, passion is definitely a key ingredient towards becoming a surgeon. Coming to some academics, many of our viewers wanted to know MBBS days to prepare them for a career.
In MBBS, like in our undergraduate days, we learn just 20% of what surgery is about, right? I mean, surgery is a very practical subject, and your first year in residency is mostly about learning. It's obviously learning about the basic surgical procedures and the basic operations. But uh, apart from that, you also have to learn the pre-operative management of a patient, the post-operative management of a patient, which are extremely important parts, and that's something we don't read about when in our MBBS curriculum, right? We have very superficial knowledge, and I'm to prepare for surgery right from MBBS to prepare for surgery residency makes no sense, to be honest. I mean, you can just go as per the syllabus, build on your basics, and then once you get a seat, once you are prepare finally going to get into training, then you should probably at the end of the session I'll suggest some books you can read and how to prepare before you join. I think that would be more important. But when it comes to MBBS, I would just say stick to your basics and follow the curriculum.
Coming to books, I'm sure everyone has read or at least heard of Bailey and Love. So when we open Bailey and Love and go through the seldom read preface, we'll find a saying: if a vessel is cut and the surgeon knows its name, the situation is serious. But if the anesthetist identifies the vessel, the situation is irretrievable. So, Dr. Rupesh, tell us how you deal with mortality on the operating table, in the OR, or in the wards, and manage complicated situations, because surgeons often have to deal with such situations.
Right. First of all, I mean, anesthetist identifying the vessel is definitely a very terrible thing that is happening. So yeah, I mean, you have to be very careful. Yeah, what they have basically focused on is a bleeder. I mean, the first day of my residency, my senior told me the biggest enemy of a surgeon is definitely a bleeder. And there are various techniques how to control one. Over time, you definitely learn all these. I will definitely not go into the technical details, but see, mortality on the operating table, it's something basically the anesthesiologist deals with more than us. I mean, like we go for the technical thing. Mortality in the operating table is there, purview. But like the post-operative management, major surgery is happening, and it's always given that they'll have certain complications. And you have to be very clear about when to identify these complications and how to deal with them. And I would say it comes with experience. It comes with practical experience, and also how much you read from these books. And yeah, I mean, I was lucky enough not to see any death on table happening, but it has happened, and it is very unfortunate. But yeah, over time you will definitely learn post-operative management, which is one of the most important things that you learn in your first year.
I recently just finished my surgical rotation and internship, and we were definitely taught how, especially because they undergo major procedures such as Whipples in our institution. So yes, Dr. Rupesh very rightly put. Often able to decide which show to row to, surgical or non-surgical. Like deciding whether we want to go for a field which involves surgery or want to go for a medical field is the first step, I believe, in choosing what you want to specialize in. So surgery is the appropriate branch for them.
See, like I said, in your undergraduate days, I mean, you just read 20% of what surgery is about. The major thing comes when you start your PG preparations and you really read a lot, you go into the depth of it. And I would say a lot of it develops when you're doing your internship. How much, like it depends how many, if you like doing the procedures, if you like to assist, you get a feel of it. So I would say if you enjoy doing this, assisting or enjoy stitching up, if you really like that, I mean, you get a taste of it in internship. But this is a very specific question, surgical or non-surgical, and like you yourself have to decide this at the end of the day. For me, I really decided it during my PG preparation a lot more. Going into the depth of the subject, I developed a certain interest for it, and I don't know, there was something that told me that no matter what, I have to choose this specialty. So I think it has to come from you. It has to come from within, and you should be really sure about a career in surgery, and you should enjoy it. Definitely, that is most important.
The thrill and excitement of standing in the OR all ready to scrub in is incomparable. I remember I used to wait for OT days and you request my seniors to allow me to scrub in certain procedures. So Dr. Rupesh, tell us about the cutting opportunities that residents get here, and how does the learning curve progress?
Right. I mean, this question is, I think, what most first year residents will have once they start their PG very soon. So basically, what the learning curve is like is the first the first 3 months is basically you're given time to get accustomed to the wards. What you learn in those first 3 months is definitely the different techniques of dressing, how to manage wounds, how to do some basic surgical procedures, such as sebaceous cyst or lipoma excision. These are very important procedures for a trainee surgeon right at the beginning, because it fine tunes your skills, and you'll also be exposed to incision and drainage of abscesses, and then debridement of diabetic foot. All these minor operations, they form the basis of your advanced surgical skills. The skills you develop during these first 3 months will help you to do your first appendectomy, which you will get probably after 3 months. This is a general rule which is followed in Bengal at least. After 3 months, you get your first appendectomy. And after that, you do countless appendectomies and all. And the next major operation after appendectomy is that they will give you exposure on how to perform a central line. And next comes how to apply a chest drain or tube thoracostomy. These are another two major operations which are difficult, but with time you will learn. And once you reach that 6 month period, you will be allowed to do an exploratory laparotomy for and Gram's patch repair. It is the first. It is a major operation for a first year resident, and it's something to master this operation. It will take your entire first year towards the end, and even the beginning of second year. So yeah, this is how the learning curve is, right? And throughout this curve, you'll learn how to manage patients pre-operatively, how to prepare patients, and how to manage them post-operatively. And obviously, we'll scrub in a lot of complicated operations such as Whipples, colectomy, anastomosis, and everything. And even assisting is very important. My senior always told me, before you become a good surgeon, you have to be a good assistant. Only then can you become a good surgeon, once you develop that intuition, right? So this is what the learning curve is like for first year. From second year, you get more hands-on experience in more complicated operations such as cholecystectomy. And in the cold OTs, the elective OTs, for a first year, I'm just saying, for a first year, the first operation they will allow you to do is a eversion of sac for hydrocele. And with that, towards the end of your first year, you will be allowed, if you are good enough, you will be allowed to do an inguinal hernia mesh repair, which I think is a very complicated operation, because it sounds all easy on, like, when you read a textbook, but when you actually open up the inguinal region and you see all those structures, it's very difficult. I mean, it can get a bit messy. So yeah, so this is your first year, and from second year you start doing open cholecystectomies, colostomies, more complicated operations. And in your third year, you get to do laparoscopic procedures, such as laparoscopic cholecystectomy, and if you're good enough, laparoscopy appendectomy. So this is how it is in a gist.
Uh, Definitely, I remember my seniors standing as assistants to surgeons, and like how meticulously they were arranging the instruments in order so that it's easier for S1 and S2 to do their jobs. Definitely, Dr. Rupesh. A
Yeah.
popular doubt plaguing the minds of MBBS students is what exactly is the difference between MS and DNB, and does that affect the future prospects of MCH later?
First of all, uh, people say MS is better than DNB. It is because of a reason, because you do Master of Surgery in mostly, this degree is available most in government hospital, where the cutting rate is very high. What do you mean by cutting rate? It is basically the amount of hands-on experience that you will get. Now the DNB degree is definitely available in private hospitals as well. So the main principal thing to consider here is to, even if you're choosing DNB, to choose a hospital where you get a lot of hands-on exposure. Because if you are not getting hands-on exposure, it is definitely suicide for a surgeon. Because no matter for a surgeon, it does not matter how many books you memorize or how much you have read or how much logic you have, until and unless you can operate. And I should say this, but I've seen people who have done their surgery in a private college, and they have had very minimal experience hands-on training, and it's very difficult for them. So you have to be very careful when choosing the institution. You have to be aware of the opportunities that are available to you. There should be plenty of hands-on experience. That is the most important thing for a surgeon. And
Definitely.
about MCH, yeah, I just want to highlight the MCH. About MCH, even if you do DNB, you can go for MCH. You can sit for MCH. It doesn't matter if you have a MS degree. I mean, it's the same exam for both. Like, you can sit in an MCH exam for neurosurgery, anything. It does not make a difference. Yeah.
So as Dr. Rupesh said, definitely choice of college is very important, because after all, it's your home for the next 3 years. And okay, so I want everyone to imagine a situation. You're sitting in the ER at midnight, and a patient is wheeled in with with history of severe abdominal pain and intake of PPIs. You examine the patient, and you find that the patient has low blood pressure, feeble pulse, the patient is unable to move, and is lying helplessly. An X-ray shows free gas under diaphragm, and the diagnosis is clinched. An exploratory laparotomy is performed, and the perforation is repaired. The next morning, you find the patient sitting up and smiling. So, Dr. Rupesh, tell us how a surgeon deals with situations in the emergency and trauma patients, and what should be kept in mind while doing so.
Yeah, I think the emergency is probably one of the most exciting places that you can be if you've taken up surgery residency. And yeah, the way you've described a perforation patient, yeah, they do have very rapid recovery. But if the perforation is not it's not very old. That means if it's just a 1 day old perforation, you will definitely have a very rapid recovery in this patient. But for me, recently, I operated on this 13-day old perforation, and when we open up the abdomen, it was like the omentum was everywhere. We call that a frozen abdomen, where you cannot identify any structure. Then it was a very difficult operation, but we eventually found out the perforation, and we could not use the omentum to, patch it up. We had to use the falciform ligament. And so that was a modification. here, and I think I have a picture of that frozen abdomen, Meenakshi, if you can share with our viewers.
Can our technical team please screen share that picture?
Yeah, so let them just share that. And when it comes to trauma management, yeah, oh yeah, okay, they're showing the pictures. Yeah, this one. So you can see this was the case. This was a 13-day-old perforation with a frozen abdomen. So if you look closely, it is very difficult to identify any structures here. And so this was a difficult operation. And this is what I'm saying. I mean, what defines you in your surgery residency is not only the basic operations, but the more complicated cases you get, the more you learn how to deal with it. It is the more complicated cases you do, and you know what to do. So it is a learning curve, and it develops over time. So coming back to trauma management, I mean, trauma is definitely one of the most exciting aspects of surgery. What my seniors always told me was quick in and quick out in the emergency. That means you have to be very rapid about your diagnosis, and if you have to shift this patient to the OR, you have to be very rapid about the operation, and you have to quickly close the abdomen and put this person on post-operative management, because in the emergency setting, you have unprepared patients, right? These patients have come up suddenly with this acute condition, and you don't have time to optimize the patient. So they are high risk patients, and that's why we follow the principle of quick in and quick out. And when it comes to trauma, it's like I believe it's like mathematics. If you read the trauma portion of Bailey's or any other book, it's really like mathematics. You have to be rapid about your diagnosis, and it's so logical. And once you diagnose this patient accurately, the trauma patients have very rapid recovery, and it's wonderful to see. Recently, we had this patient during the cyclone. We had this patient. He underwent a road traffic accident. He was sitting in a car in the front seat with a seat belt on. So we call that seat belt syndrome. When you get a imprint abrasion of the seat belt on the chest and the abdomen. So the most common thing to happen there is due to deceleration injury is basically a mesenteric tear. And mesenteric tear can cause a lot of bleeding and all. So yeah, that's one case that we had, and this guy recovered in just 7 days and was sent home. And if you're really good, about your diagnosis and management, patients will have very rapid recovery. For that, you have to read a lot. You have to read the subject. You have to enjoy the subject, and you have to be very serious about when a trauma patients arrive. Yeah, definitely.
Thank you, Dr. Rupesh, for sharing those experiences and those cases. Those were really fascinating to hear. Surgery is a demanding field, both physically and emotionally. How does one cope with the daily stresses and strive towards a good mental and physical health as a surgical resident? Dr. Rupesh.
See, I would always say that you should have you should know how to blow off some steam. If you're working hard, you should play hard as well. If you want to party, you can. If you want to read a book, if that works for you, you can. If watching a movie relaxes you, you can. If going out somewhere or for a quiet evening walk works for you, you can. I mean, you have to find your own. You have to find your own activities, and you have to. I mean, it is stressful. I mean, medicine in general is stressful. And it's not only surgery. Any field you go, it is stressful. Uh, you will have stressors throughout your life, be it family issues or be it work issues, and you have to deal with them over time. And there are obviously a lot of outlets to deal with them. And I don't think it's right to say that surgery itself is very physically demanding and emotionally, and other fields are not. I think it just falls in the common pool of medicine being a very demanding field, because you can be called at any time, and you have to be very serious about your work, and you have to be very careful. So it's just a generalized thing that is and I would say always have time for yourself, even if it's additional activities, time for studying, whatever you enjoy, and you'll be fine. It's not
Definitely,
something wrong.
balance is the key, I believe. So,
Right.
Dr. Rupesh, our audience wanted some guidance on how to make the correct choice with regards to colleges they should choose during their surgical residency? You covered most part of it during the MS and DNB answer, but if you could share some light on
Right.
this, if there are any other points.
See, the way I gave my college preference was as per the seniors told me, like how the seniors told me. But the thing is, apart from right now, after spending a lot of time as a postgrad resident, what I can tell you is that what is most important, other than the facilities, is your work environment. What is extremely important is your immediate senior, because your immediate senior will guide you. You'll be your teacher, and the relationship you have with them is most important. I mean, it'll be real, and your rank does not decide it. How much you study or your rank does not decide it. It's just pure luck, sadly. And I'm very lucky to have a really awesome senior who has really guided me and taught me. And the work environment, if it's healthy and you will enjoy work, you would definitely go back to work every day, with a smile on your face. And I think that is more important than the facilities. It's the people who you work with, your seniors, your teachers. Yeah, so you have to be very, if I know you can't control all this, but yeah, I would say that is probably the most important aspect, other than apart from college. Yeah.
Work environment is definitely a very crucial point to consider while choosing residency. Definitely, I have seen instances and examples of what a good work environment can do to a resident versus what a poor work environment, what an effect it can have on them. So definitely.
Right.
So one of the burning questions that all of us have to face from relatives when we attend parties is, we specialize in what? It's like the modern era is all about super specialization. So Dr. Rupesh, tell us something about MCH post-surgical residency and how one can gain experience both in India and abroad.
Right. I mean, see, what my professor tells me is that general surgery is a super specialization in itself. I mean, because the things you will deal with as a general surgeon, nobody will deal with once you super specialize. Once you go into neurosurgery, you'll forget about the general surgery aspects of it. If you go into neurosurgery, you will always refer this patient who requires, general surgical expertise to a general surgeon, right? So I would say it's a choice. Once you are in your second year in residency, you'll have rotations in super specialty departments, that is cardiothoracic vascular surgery, plastic surgery, pediatric surgery, and you will spend a month or 2 months in each of them, and you will get a taste of what it's like to be a plastic surgeon or a neurosurgeon. And if you like it, if you really enjoy it more than what you're doing in general surgery, you can definitely go for it. But once again, you have to be the choice should be about your life. It should not be always about just because what other people say. It is about what you enjoy, right? And when it comes to abroad also, there are many things to do. You can have fellowships in America, you can go for MRCS degree, and you can work in the United Kingdom as well. I mean, there are many opportunities, and but I would not want you guys to focus on that right now in your formative years. I think you should just focus on your basics, and uh, and if you really want, focus on your studies right now when it comes to surgery. Yeah.
Dr. Rupesh, would you recommend the 6-year integrated courses that are offered in some institutes such as NIMHANS, AIMS, CMC Vellore, with regards to neurosurgery or plastic surgery?
See, I can have a personal opinion on this, but since I am not part of a 6-year super specialization course, I would not say too much on this. I mean, the thing is that first of all, you have to be extremely sure that you really want to do this particular thing, because this is a long commitment you're making. 6 years is a really, really long time, and you have to be extremely sure. I personally believe a person who has just given his post graduation exam lacks that particular knowledge to know what neurosurgery is about, to know what pediatric surgery is about, to enter into this field. But if you think you have adequate exposure, if you think you know what it is all about, if you think you know all the detailed aspects of it, then definitely you should choose. But yeah, for me, I would think that it would be a really long commitment, and I really didn't have a lot of idea about all this, 6-year courses. So I would say, most professors also say, I mean, go for general surgery first and then, go. But this is purely a personal opinion, and you should, to gain more information on this topic, you should just talk to someone who's doing this 6-year course and see what his or her experience is like. Yeah.
So, Dr. Rupesh, tell us, how does a surgical resident prepare during their formative years, both academically and practically?
So I will just take this question to the the first year, the new first years who will be joining. So I would just recommend you, since you have got a lot of time right now. Yeah, I mean, just buy 2 books. Bailey and Love is a must. That's for everyone. You basically start reading it from your PG prep. So and the another is you should buy is definitely Farkhausen's textbook of operative surgery. If the technical team can share the link, that will be great. So basically, Farkhausen's is very important, and what I would like you guys to read from those books is definitely trauma management, the chapter on acute abdomen, preoperative and postoperative management from both these books. And when it comes to operative surgery, I think you should read as you go. As you go from one. As you go, if you're about, say, you're about to perform a central line, you should always refer to this book before performing, and you should not go in blind. Always read about the operation before you do one. So yeah, so this would be my advice to to the first year residents. And one thing I want to mention is that you should be, when you join your residency in your first year, I mean, I think your attitude also makes a lot of difference. We all know that first impression is the last impression. So, you should be very serious right from your first, on your first day. And you should be dressed properly when you meet your professors on your first day, wear formals and everything. You have to listen, you have to appear as if you're very serious about what is going on, and you constantly, about the patients in the ward and everything. So your attitude is very important, and to develop a good impression also is important. And for example, if I would like my junior to be very serious about work in the wards, I would like him or her to be extremely serious about caring for the patients and management of the patients. So yeah, your attitude is very important as well.
Dr. Rupesh, tell us, how does one inculcate the confidence as freshers, like as first year surgical residents, if they are just thrown in to do a procedure and there is nobody around, and maybe it's their first time doing it independently? So how does one bring in the confidence?
Right, right. So this is a good question. Like I would give you an analogy. I mean, I remember when you were small and you were basically riding a bike, riding a bicycle, and you fell down a few times. And time, your parents just let go of the wheels, and you just rode the bicycle by yourself. So I would just give you one example of what happened to me back in my first year. So basically, there was this patient came in with multiple rib fractures. This is just one incident that I'm talking to you about. This patient came with in multiple rib fractures and a femur fracture. So he was basically he was in hemorrhagic shock because he was bleeding. Plus, because of the rib fractures, it was compromising his breathing capacity, and his saturation was falling. So this was a really complicated case. And before that, I had performed the chest drain only under supervision of my seniors when he was by my side, helping me out. So this complicated case was also supposed to be, I was supposed to have someone senior with me by my side. But unfortunately, at that, or I would rather say fortunately, that day, there was this expert laparotomy going on the other table, and suddenly they came across some intraoperative complication for which they could not come to my aid, and I had to perform the tube thoracostomy with one of my interns by myself, and it was a complicated procedure. And once you're pushed into it, you have to make a choice that I can't sit and stand. If I sit and stand, this patient will die. but definitely you've read about the procedure, you know what to do, and you just follow the technique and you just go for it. And this patient, I was able to do it in one go, and this patient had wonderful recovery. I mean, we were able to send this patient home, and this is probably how I gained confidence in just one surgical procedure. And similar issues happen in other, your senior just, one day he just comes and he says that you do it. I'll be sitting in that other room. If you have some complication, if you face some complication, don't be afraid to ask for help. And I'll come to help, but I want you to do this on your own. So yeah, it's something like riding a bicycle, and one fine day you will just, your senior will just let go, and you'll be able to do it. So this is what this is where your seniors come in. You have to, your immediate senior. It's very important to have a good senior. And definitely for a first year surgical resident, I would also say that whenever you face any operative difficulty while performing any procedure, the first thing you do is always cry for help. Do not, I say, think that I should manage this on my own. What would my seniors think if I can't do it? It does not matter. The patient's safety comes first. You cry for help, and your seniors will help you. That is probably the message I want to give.
We definitely learn from our mistakes. That is definitely true. And as freshers, we are going to make mistakes, but we are going to learn from them. So lastly, I believe no discussion is complete without addressing this one question in these times. Dr. Rupesh, what advice would you give to the fresh residents of 2020 regarding safety measures while learning and serving amidst a pandemic?
Right. So basically, the cutting rate has gone down a little because mostly, the patient load has also gone down a little. But we have actually taken this as a break. Towards the end of everything after 1 year, you need a little bit of break. But initially, when I think the new residents will be joining, very soon, maybe in 2-3 weeks time, and I would say that initially you will not have that much pressure, but be prepared, because once everything normalizes, the workload will definitely rise, and yeah, you will be expected to work very hard. And I would always say, safety first. Your seniors will never compromise on your safety. They will never ask you to do something that is hazardous to your health. We will always think of your safety first, and we'll always help you out when it comes to your safety. And don't be afraid of that. And I think we are all dealing with this pandemic situation, and we are all doing our bit. Yeah, we have to make do with what we have, make all the, take all the precautions, but it's something that we have to live with right now. And hospitals can't stop, right? And as a surgeon, you have to operate when it's an emergency. So that's how it is.
So we have some interesting pictures that Dr. Rupesh shared with us. Can we please show the pictures? And Dr. Rupesh, if you would
Yeah.
like to say something about the pictures.
Yeah, this is how crazy the emergency can get. You can definitely see a foreign body per rectum. That was probably the most interesting case, I would rather say, I had seen. So yeah, so but fortunately this patient, there was no perforation of the rectum. There was just minor mucosal tear, and we could just remove it under anesthesia without doing a more invasive procedure. So yeah, can we switch on to the next slide? Yeah, this I think I already showed you. Yeah, this is probably something I really like. When in chest trauma, you always have to put in a chest drain. The one thing my senior taught was that when it comes to the abdomen, you most of the times you have to perform an exploratory laparotomy. It's an open procedure, but most chest trauma stuff can be managed with just a chest drain. So learning a chest drain for a surgical residency is extremely important. So I think you can see the hemopneumothorax pre-op image, and in the next image you can see that after putting the chest drain, this patient has definitely had a rapid recovery with resolution of all the pneumothorax. Yeah. Next slide, please. Yeah, yeah. The next one. Yeah. So yeah, this is something I'm very proud of. Now, can we just switch on to the leg trauma slide? Yeah. So this is something I'm very proud of. This patient actually presented to me when in the beginning of my first year, and this I want to emphasize how important dressing a wound is. Learning dressing techniques for a first year. So this patient had been in this road traffic accident, and he had presented with this massive leg trauma, and you can actually see the exposed bone over there. And I was just able to approximate the skin via stay sutures, as you can see the stay sutures given in the first picture. So this patient was really serious, and I was given this duty that by my seniors that you have to do regular dressing, regular triple layer dressing for this patient for the next 3 months. And this patient, you can see this patient who I thought would never walk is walking and is smiling. So I think this is very important to strive for in our residency. Next picture, please. Next slide. Yeah. So this is an interesting picture of one of the surgical procedures you get to assist in. Definitely, I've not performed this myself. This is a superficial parotidectomy for superficial parotid tumors. It's an interesting neck procedure. Like basically in surgery, my professor tells that a good surgeon knows to operate everything from the head to the toes, right? So everything falls under us. So yeah, this is a superficial parotidectomy. Next. This is actually towards the end of the procedure. This patient had multinodular goiter, and which was compressing his airway, and it was really huge. And I wish I could have shown you a preoperative picture. This is a total thyroidectomy that has been done. One of the surgical procedures you will get, to perform in your third year. Yeah. Next. Yeah, this is the Whipple's procedure. This is probably the biggest or the most, the most intense operation that a general surgeon can do. And it's a long operation. I mean, some people take 6 hours, some take 7 hours, but my professor, he does it in like under 4 hours. Yeah. And I think this is you can see the specimen. It's a beautifully resected specimen. You can see the distal stomach, the duodenum, the gallbladder, entering into it. It's a wonderful, picture of the specimen. Yeah. Next picture, please. Oh, yeah.
Okay, so
thank you, the team.
Yes, can we please zoom in to the collage of our team members? So it's a Sunday evening, and we at SAMSA are very well aware that there are 100 different things all of you could be doing on a Sunday evening, but you decided to spend it with us, and we are so thankful to you for it. So we would like you to meet our team, without whom this endeavor was impossible. We have Abhirup Sharkar, a second year from MCK, who handed out the lovely posters for this webinar. We have Anisha Basu, a first year from RG Corps, who was responsible for the wonderful social media posts. Orko Jyoti, a first year from RG Corps, who's hosting the webinar. And we have Ipshita Prasad, a first year from RG Corps, who has handled everything in this webinar, from the write-ups to contacting people to making the slides. Thank you so much. Such young minds, and they work so brilliantly. That is the strength of SAMSA that really makes up our organization. So we come to a close for this session. I would like to thank the entire executive board at SAMSA, which is very much like our family. And also we would want those of you who are not yet SAMSA members to consider joining SAMSA, because SAMSA always works towards enhancing your learning opportunities as a student and serving the community. So I hope we can provide you with some valuable experiences as members. I would also like to thank our directors, Dr. Rupesh, Dr. Rishabh, Dr. Priyadarshini, our general secretaries, Dr. Ayush, Dr. Shomdatta, and definitely the entire executive board of SAMSA, who works tirelessly throughout the year trying to maintain our organization and let it soar high. So the links that were shared will be emailed to you as well by our team. Good luck, and we hope we've been able to clear your doubts regarding surgical residency. And definitely, there are a lot of reality TV shows and soaps about surgery, like Grey's Anatomy and Scrubs. So one of our favorite characters, Derek Shepherd from Grey, said, "It is a beautiful day to save lives. So let's have some fun. Let your passion shine through and take you forward." Thank you all. Good night.
Thank you, Meenakshi, and everyone. Good night.
Thank you.